Knee osteophytes. Causes, symptoms, and prevention. Knee osteophytes, also known as knee osteophytes, are the formation of bone spurs, around the knee joint, often as a result of osteoarthritis. These osteophytes appear when the articular cartilage wears away, leading to friction between the ends of the bones, stimulating the body to create new bone to repair it. Causes of knee osteophytes. Knee osteophytes are often related to the natural degenerative process or factors that damage the knee joint. The main causes include 1. Knee osteoarthritis. With age, the knee cartilage wears down, reducing its ability to absorb force, leading to friction between the ends of the bones. The friction stimulates the body to create bone spurs to stabilize the joint, but these spurs can cause pain and limit movement. 2. Knee injury. Previous injury, dislocation, torn ligaments, fractures around the knee joint, damages the cartilage and bone, promoting the formation of bone spurs. Repetitive activities that put pressure on the knee joint, excessive running, high-intensity sports. 3. Arthritis. Rheumatoid arthritis, an autoimmune disease that damages the synovial membrane and cartilage, leading to degeneration and bone spurs. Gouty arthritis. Urate crystals accumulate in the joint, causing inflammation and joint damage. 4. Mechanical and lifestyle factors. Overweight, obesity. Large body weight puts excessive pressure on the knee joint, causing cartilage to wear out faster. Wrong posture. Standing, walking, or sitting in the wrong position for a long time, such as squatting for too long. Heavy work. Carrying heavy loads, kneeling frequently, or working in a bent knee position. 5. Genetic factors. Family history of joint diseases, osteoarthritis, arthritis, increases the risk of knee spurs. 6. Metabolic disorders. Diabetes and dyslipidemia can reduce blood circulation to the joint, promoting degeneration and bone spur formation. Symptoms of knee spurs. Symptoms of knee spurs can range from mild to severe, depending on the degree of degeneration and the location of the bone spurs. Some cases have no obvious symptoms, detected by X-ray. Common symptoms include 1. Knee pain. Dull or sharp pain in the knee joint, especially when moving, walking, climbing stairs, standing up and sitting down. And pain increases in cold or humid weather. Pain may decrease with rest, but recur with activity. 2. Stiffness. The knee joint is stiff, difficult to bend or straighten completely, especially in the morning stiffness. Feeling of stuck or locked joint when moving. 3. Limited mobility. Range of motion of the knee joint is reduced, making it difficult to perform movements such as kneeling or squatting. Walking or standing for a long time causes fatigue and pain. 4. Swelling and inflammation. The knee joint may swell slightly due to inflammation of the synovial membrane or accumulation of fluid in the joint. Bone spurs rub against the surrounding soft tissue, causing irritation. 5. Joint noises. A crackling or crackling sound is heard when bending, stretching the knee because the joint surface is no longer smooth. 6. Joint deformity, severe. In severe cases, the knee joint may be deformed, bowed or misaligned, making it difficult to walk. Note, if the bone spur compresses the nerves or blood vessels, it may cause numbness, tingling, or weakness in the legs. How to prevent knee spurs. Although osteoarthritis cannot be completely prevented, the following measures can reduce the risk of knee spurs and slow the progression of the disease. 1. Maintain a reasonable weight. Lose weight if overweight or obese to reduce pressure on the knee joint. Monitor your body mass index, BMI, between 18.5 to 24.9. Combine a healthy diet with exercise to control your weight. 2. Diet to support joint health. Supplement foods rich in calcium, milk, cheese, green vegetables, vitamin D, salmon, egg yolks, sun exposure, to strengthen bone health. Eat foods rich in omega-3, sardines, chia seeds, and anti-inflammatory substances, walnuts, turmeric, ginger, to reduce arthritis. Limit processed foods, foods high in sugar and saturated fats. Drink enough water, 1.5 to 2 liters day, to maintain moisture for cartilage. 3. Exercise appropriately. Do exercises to strengthen the muscles around the knee joint, quadriceps, hamstrings, to support and reduce pressure on the joint. Prioritize low-impact activities such as swimming, cycling, yoga, or light walking, 30 minutes day, 4 to 5 times week. Avoid activities that put a lot of pressure on the knee, long-distance running, high jumping, carrying heavy loads. Warm up thoroughly before exercising and stretch after exercising to avoid injury. 4. Maintain correct posture. Avoid squatting, kneeling, or standing in one position for too long. Use a chair with a backrest and keep your knees at a 90-degree angle when sitting. When carrying, distribute weight evenly across both legs. 5. Limit injury and protect the knee joint. Use suitable, well-padded shoes to reduce pressure when walking or running. Wear a knee brace or protective bandage when playing sports or doing heavy work. Avoid sudden movements or strong twisting of the knee. 6. Regular health checkups. Have regular bone and joint health checkups, especially if there is a family history of joint disease or persistent knee pain. Get an X-ray or MRI if you suspect osteoarthritis or joint spurs for early detection. Consult an orthopedic specialist if there are any unusual signs. 7. Control underlying medical conditions. Manage conditions such as diabetes, gout, or rheumatoid arthritis well to reduce the risk of joint damage. Take medications as prescribed and have regular checkups to control inflammation. 8. Avoid other risk factors. Don't smoke, as it reduces blood flow to joints and cartilage. Limit exposure to toxic chemicals or environments that increase inflammation, such as heavy pollution. Important notes. When to see a doctor. If you have persistent knee pain, swelling, stiffness, or difficulty moving, see a rheumatologist for evaluation. Symptoms such as leg numbness, muscle weakness, or joint deformity should be checked immediately to avoid complications. Thanks for watching the video. Wish you and your family good health and happiness.